Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. Welcome to our Facebook Live session with Dr. Stuart Nelson of the Beckman Laser Institute. Today's topic is laser therapy, when to begin and when to end. Let us see your questions come through. Say hi if you're on. Jody Lee, good to see you. Jody Lee and Julia Sams just joined. Hi, guys. Nice to see you. I'm just going to get them on here. There we go. Sorry, we just keep kind of going out. Checking in. Okay. So, hi, Jody Lee, Sue Ellen. Let's see your questions regarding pulse-dye laser. And for those who are just joining us, our next Facebook Live session will be in Europe next month. So, hi from Australia. Let us see your question, Sue Ellen. Dr. Nelson's right here, ready to answer your question. Hi, Lisa. So the questions will appear over there, as you can see. We're not going to see them streaming. Dr. Nelson, what is the difference between using a 1.5 ms pulse with a 3 ms pulse width for laser?
Those are the pulse durations of the laser exposure. For infants and young children, we tend to use shorter pulse durations of the laser, whereas for adults, we use longer. With the shorter pulse durations, such as the 1.5 milliseconds, you're going to have much more bruising after the laser treatment, as opposed to the longer 3 millisecond pulse.
Ready for our next question. Hi, Donna. Thank you for joining us. Hi, Sue Ellen, Jody, Julia. We're ready to take our next question. Once these questions start rolling in pretty rapid fire, we're going to have to be quick with them. So if you haven't had a question answered, please post it now. Jacqueline Mizani just joined us. Kelly Matthews, let us see your questions. So you just have to, I can do that. So Jennifer writes, when do you know when it is time to enter, stop laser treatments and start in maintenance?
Well, for most families, we have to have a discussion and let the family really make the decision. But if we haven't seen significant improvement after, I would say, 3 laser procedures, then I would talk to the family about backing off and going to procedures perhaps every 6 to 12 months or once or twice a year.
Kelsey just wrote that she had a treatment 7 days ago and it's practically healed. She said normally it takes 14 days. Does quick healing mean it wasn't aggressive enough?
Well, it's hard to say. It depends on what the pulse duration of the laser that was used, as well as the energy density. If you happen to have those treatment parameters and can forward to those to us, I'd be happy to comment. But just, some people, it just does take a little bit longer. After somebody's had a series of treatments very close together, people can almost get an irritant dermatitis of the skin itself as a result of just doing the laser treatments so frequently. So, I mean, it's not unusual for it to take 10 days to 2 weeks to heal completely.
Hi, Kimberly. Thanks for joining us. Big hug to my girl, Frankie, and the kids. Hi, Karina. Nice to see you on. Karina Grubb just joined. We're ready to take more questions. Anything new in laser, Dr. Nelson?
Well, beginning of next year, with the hope that the new Candela device that has a larger spot size will be coming out. So the first part of next year. So hopefully the first part of next year we'll have the new Prima device here at Beckman. Good evening, Dr. Cheras. I'm looking forward to seeing your son Rodrigo on Wednesday. He's done continuing very well. He's continuing to fade. So I would say, at least for the near moment, I would encourage you and Ariana to maybe continue to bring him, every 2 to 3 months, and then maybe as we start seeing less fading, maybe we can talk about, going to maybe once or twice a year.
Sue Ellen wants to know, is there pain associated with laser treatment?
The laser treatment hurts. It definitely does. It feels like getting snapped with a rubber band, particularly when you're using shorter pulse durations of the laser, because when you compress all of the laser energy into a very short period of time, the peak power of the laser is much higher. So the laser procedure is definitely painful.
Is that with or without anesthesia?
Well, I'm assuming she's not commenting on anesthesia, so I'm
Okay.
assuming it's without.
Sarah wants to know, what is the likelihood of the stain returning after treatment? 20 months old with stain on chest.
Well, on the chest is a very good site. The skin is very thin there, and those port wine stains tend to respond very, very well to pulse dye laser. So I would actually be quite surprised if there was a recurrence of a port wine stain on the chest and on the neck.
Welcome, Christy and James Pasqua Batara. Post your questions for Dr. Nelson regarding laser treatment of any vascular birthmark. He's also a management specialist in face syndrome and runs the clinic here at the Beckman Laser Institute.
We've been seeing a lot of Fassi syndrome here recently. Mr. and Miss AJ Palmatier, are there any negative consequences of laser treatment? Probably the most frequent one we see is what we call post-inflammatory hyperpigmentation, where patients can get a kind of a brown discoloration of the skin after the laser treatment. This is due to the fact that the melanin in the normal skin above the port wine stain does absorb the laser light, but that is something that usually resolves spontaneously without treatment or sequelae. Typically, we'll tell patients it may take 3 to 6 months to go away completely, but it does, and usually no treatment is indicated.
Jennifer wants to know when to start laser with general anesthesia for children.
Well, with our anesthesiologists here, and we only use pediatric anesthesiologists, typically we'll start around the age of 6 months. Children, infants and young children, there is a higher incidence of laryngospasm in much younger children, so we will wait till they're about 6 months. But with that said, if there's an emergent condition where we have to treat the patient, if the hemangioma is ulcerating or something, for example, then we'll start the treatment or even younger.
Melody said her 3-year-old has had 7 treatments. Her husband and she are torn, wondering if it would be wrong to stop it since they feel it's for cosmetic, but are they okay with, and they're okay with their having it, but I believe that the American Academy of Dermatology has said it is not cosmetic, correct?
Well, it's definitely not cosmetic, and I would encourage you, Melody, and your husband to stay with it, just because as your child does get older, the port wine stained blood vessels will naturally dilate, and your child's birthmark is slowly and insidiously over time going to become darker. We definitely know that infants and young children respond better to the laser, so I would encourage you to continue with that.
Sarah says that their stain's been treated 5 times. It's in a lacy pattern. The dots are clear because it's cosmetic, and she doesn't like the treatment. We stopped. The stain is stubborn on her arm and hand. What are the risks of anesthesia at 20 months?
Well, the lacy pattern, Sarah, probably has to do with just the fact that the laser pulses haven't been completely overlapped. I mean, it's difficult to overlap a circular area, so that can certainly be filled in with subsequent laser treatment, so I wouldn't be concerned about that. The more distal a port wine stain is on the extremity, particularly the distal arm and hand, they do tend to be more resistant to the treatment, so more treatments will be required. And the risks of anesthesia, assuming your child is a young, healthy child, really is no higher than the general population.
Scott Couples wants to know if you can talk a little bit about the treatment of adult port wine stain that was not treated as a child.
Well, for the adult patients, we have a large population of patients here at Beckman. Those patients we treat with the longer pulses of the pulse dye laser, as well as also some patients who have thicker or nodular lesions. For those where we need the light to penetrate deeper into the skin to coagulate the larger blood vessels, for those patients, sometimes we'll also use the Alexandrite laser.
Vincent says, once a port wine stain is lightened to where the patients like it, how often do they need to participate in laser treatment to prevent the darkening or hypertrophy? I
would say, Vincent, once or twice a year, every 6 to 12 months.
Jessica wants to know what you recommend for areas with hair follicles, such as the eyebrows that are impacted by port wine. What will the pulse dye laser do?
Well, that's also the next question by Megan Doherty as well. We tend to stay away from hair-bearing areas because there's about a 20% chance that you can induce alopecia. So I let the family, decide. I try and stay out of the hairline, particularly if it's a female child where we're not concerned about alopecia. But for around the eyebrows, I do the best I can to stay away from the eyebrow and try and focus the laser beam away from the follicles.
Christy, your question is valid, even though we're talking about lasers today. It's really anything about port wines. And she said her son's covers 60% of her body, and that, but will the port wine get thicker? They've been to several doctors and no one has an answer. One leg and one foot is bigger, still waiting on a biopsy that is supposed to take a year.
Well, my initial reaction to reading this is that your child, number one, needs some type of imaging studies of that extremity. You didn't say whether it's the right or left lower extremity, but I would encourage you to have your pediatrician order a magnetic resonance angiogram study of that entire distal extremity to rule out underlying Klippel-Trenaunay syndrome. And also, because such a large area is involved, I think your child also needs a genetics workup just to make sure there's no underlying mutation like a RASA1 or some other problem that could be responsible for the large distribution of the lesion.
Crystal says that her child has had 25 laser procedures and the dermatologist has labeled it laser resistant and recommends discontinuing. What would you recommend?
Well, I would want to have review all of the laser treatment parameters, and one of the things that we like to do is to change the pulse duration of the laser exposure. Generally, when you do that, you can achieve further treatment. So I would encourage you and your physician to review exactly what treatment parameters were used and to consider changing the pulse duration of the laser exposure.
Alicia said that her child has had 15 treatments with little lightening located on face, classic V2. What advice do you give?
Well, again, I would review which pulse durations of the laser exposure have been used and to give strong consideration to changing that to target blood vessels of different sizes. Children here at our institute, we classically and routinely change the pulse duration of the laser exposure because we know if we took a biopsy of the lesion, you would see a vast heterogeneity in terms of blood vessel size.
Sarah says that what are the complications of a port wine stain on her daughter's hand? That thumb and 3 fingers, palm, and back of the hand are completely involved.
Well, the primary concern is that she's going to develop hypertrophy of the digits on that extremity. So I would make sure that that child has had imaging studies to, number one, rule out Klippel-Trenaunay syndrome, and number two, to see if there's something that an interventional radiologist can do to change the shunting of the blood, perhaps to decrease the amount of blood flow in that extremity.
I can answer Jody's question. She wants to know why people use the word cosmetic and how to stop getting them to use it. It's for 50, 60, 70 years they've been classifying vascular anomalies as cosmetic. Slowly but surely, we've been working with the American Academy of Pediatrics and Dermatology to reverse that wording to say it is a medical necessity, it's a cutaneous stain, it's a vascular anomaly, but we really want to shy away from that word cosmetic because then it forces the treatment into a denial because it's cosmetic, and these are definitely not cosmetic. Would you agree?
Yeah, well, in our medical letters, we've developed a good letter now where we talk about all of the complications that can happen as a result of having a port wine stain over time. And most of the time, I would say well over 95% of the time, we're able to get these covered as a medical necessity. So that hasn't been as much of an issue recently as it has been in the past.
Jennifer has a good question. She wants to know, is there an average number of treatments for optimal results?
I tell families at the initial consultation that we're probably looking at least 5 to 10 laser treatments before we're really going to have a good idea as to exactly how well that child's port wine stain is going to respond.
And Heather says her daughter's port wine stain is all over her ear and seems to be inside her ear. What can they do to treat or expect over the years? Could there be hearing issues?
Well, usually these are malformations of the skin. They don't involve the inner ear, so I would not be concerned about the bony structures of the ear. But if the lesion does become hypertrophied, you could get occlusion of the external auditory canal. So I think your daughter should be evaluated by a pediatric otolaryngologist to make sure that the external auditory canal is open. The external ear can certainly be treated. If it's not treated, you can sometimes develop hypertrophy of the ear. So I would encourage your child, to seek treatment and to have that area of the ear treated as soon as possible.
And yeah, we have heard of some of these cases, Heather, over the years where they do have hearing issues, and at first they think it's not related, later to find out it is. So what Dr. Nelson said is correct. See a good pediatric ENT that's familiar with vascular anomalies, and you can get a list of those on our website at birthmark.org. Nicole said that her daughter's hemangioma covers her entire arm and hand. Would laser treatment broken into sections, or can it be done all at one time?
For entire arm and a hand, depending on the age of your daughter, Nicole, we typically here at Beckman would do it all at one time.
And under anesthesia, right?
Well, again, it depends on the age of the child. You know, is this child on concurrent propranolol treatment, Nicole? Is she on concurrent timolol treatment? How old is she? These are all factors that go into the calculus of deciding whether or not we would treat your daughter under anesthesia or not.
So Christy says that her son has had an MRI on the head and legs, and they see a genetics doctor. Just
Okay,
make sure,
good.
just make sure, Christy, that you see a vascular anomalies expert. They range in what they are in the sorry, our light went out. In the room, we have to get the light back on.
The University of California has energy conservation, so unless it sees me, it doesn't know that I'm here.
So anyways, you're doing good, Christy, but see a vascular anomalies expert to make sure the right testing is being done. And a list of those are at the Vascular Birthmarks Foundation website at birthmark.org. And you can also email myself at birthmark.org/Dr. Linda, or you can email Dr. Nelson at birthmark.org/Nelson. Hi, Cassie, welcome. So we're caught up with our questions. We're only 15 minutes in. We've had quite a few questions. So please put forth your questions, because we do have, you know, we're kind of at a standstill now. We're caught up, so that's good. We're right on track. And as Dr. Nelson mentioned, he will be using a new laser, testing out a new laser after the beginning of the year, the Primo laser, right?
It's called the Prima.
Prima.
It's the next iteration of the pulse dye laser made by Syneron Candela.
And doesn't it combine the RF with it, the radio?
Well, that's controversial whether or not the radio frequency will help. We tested this device on a number of patients a year or so ago, and quite frankly, we did not find the radio frequency to be particularly helpful.
So I guess you'll have to see.
So the company is trying to decide whether they're going to incorporate that into the laser or whether they're going to make it an addition to the device.
So when you do have this new laser, will you have a study? Will you have volunteers? How will you roll it out for treatment?
Well, we're going to start using it. We've already made the deposit on the laser, so I'm just waiting for the company to announce that it's in its final form and get ready to ship it. And we'll start treating patients as soon as possible.
Awesome. That's great. Okay, so next questions, anybody on treatment of vascular anomalies, port wine stains, laser? And by the way, our monitor continues to go dark, so I'm hoping that you don't see dark spots in it. I'm thinking that you guys are seeing us, that the camera's picking up, but I think the monitor just kind of goes quiet on us. And so we have to click our finger and wave our hands to keep the lights on. And
we can do it in the dark. We can read the questions.
Maybe we will show up better.
We'll glow.
Hi, Kathy from Florida. She's one of our ambassadors, and Cassie joined, and Christy Blackburn, Heather. I think we covered your question. Jody Lee, I think we answered the question that you posted, which was a good question.
Can you scroll back up? Are there questions that we missed?
No, we didn't miss any, but
okay.
It won't go back up.
Because there was a couple there. It got kind of crazy.
Yeah, I got them. We're all set. Just waiting for some more questions to come in. I know that a lot of the people from Europe that wanted to come in, we're going to have somebody send in their questions or type them in, because it is like 2 o'clock in the morning there.
It is 2 o'clock.
It is 2 o'clock, so they'll be able to watch this tomorrow. This will be recorded and posted on our page. Also, the Vascular Birthmarks Annual Conference will be next year in New York City, and it will be Columbus weekend. I believe it will be October 6th. So you'll see an announcement about that right around January or February. You can start signing up. Dr. Nelson will be there with Dr. Geronimus, 2 of the top laser experts in the world, Dr. Wayner, Dr. Levitin, Dr. O, Dr. Rosen, Dr. Mim. All of our experts come to our conference every year. This year we had 147 clinic appointments. It was a very successful conference. Dr. Nelson started doing the free laser treatments this year, and next time we'll have him here, and we'll have the free laser treatments in New York. So we're excited about that. We're always excited about our conference. Not seeing any more questions come in. I'm hoping that this isn't frozen.
Well, you can see somebody's on below, but you can't see their,
Right.
after Cassie, you can see there's an image. I don't know whether the question was
Okay, this may have been asked already. For smaller port wines localized over the left nair, found at birth, at what point would you start laser for the infant? Right now, mine is 6 weeks old. Have been waiting to make sure not an infantile hemangioma. No change, so Pete Derm diagnosed it as a port wine. Well, you can tell her too.
Sometimes it's difficult to decide between an infantile hemangioma or a port wine stain, but the clinical management, Christina, is going to be the same. It's going to be the pulse dye laser. So I would encourage you to have your child treated as soon as possible. I mean, that's a procedure that can be done easily as an outpatient in an office-based setting with just a couple of pulses of the laser. So,
but I
would encourage you to do it.
Yeah, I'm thinking she might be from Europe, using the word nair, and if she is, they're very not as proactive as we are. But can't she do the blanch test herself? And if it blanches, that if she presses on the stain with her thumb and it blanches, then it's a hemangioma. And if it doesn't blanch, it's a port wine.
No, they'll both blanch with firm pressure. I mean, the only way to make a definitive diagnosis would be to do a biopsy and stain it for GLUT1, and I would not recommend you do that on a lesion so small. Just have it treated, Christina.
Okay. So Cassie said her daughter's port wine is on her hand, arm, chest, and back. We've had 6 treatments under GA, treating every 6 to 8 weeks except during the summer. They live in Florida. We have almost total clearance, which is phenomenal.
That's wonderful.
Our
Cassie.
doctor is wanting to stop and take a 6 months break or shorter, depending on if it starts darkening. Is 6 to 8 treatments too soon to go into maintenance?
No, not at all. I mean, if you're seeing excellent results, I mean, you said your arm, chest, and back, I mean, those are areas that I would expect do respond better to the laser. It's not unusual to see the hand to be a little bit more resistant. I mean, I haven't had the opportunity to review pictures, but I mean, you could certainly continue with the hand, but it would not, be unreasonable to see just how she responds over a course of a couple of months. So taking a short break would not be unrealistic.
Brooke says her 6-week-old has a large V3 bilateral port wine also across the chin. Is this typically a hard area to treat? It was deep purple color at birth.
Well, the question is this: when you see a lesion like this in the V3 dermatomal distribution, I would be concerned that whether or not the diagnosis is actually correct. I would be concerned that your child may have a hemangioma, and I would encourage you in the strongest terms possible to have your child evaluated by a pediatric otolaryngologist, just to make sure there's no upper airway involvement, particularly of the larynx. Later on we can start talking about laser treatment, but call your pediatrician tomorrow and have your child seen by a pediatric otolaryngologist to make sure that there's no upper airway involvement. When you see these beard-type distributions, there's about a 15 to 20% chance that there can be an upper airway involvement.
And Brooke uses the word color, C-O-L-O-U-R, so
Probably
I'm thinking from Europe, so it's going to be hard, but Gosh does have a treatment center. Sarah says, is there any indication that a port wine is related to other vascular anomalies?
Well, there are the classical ones, Sturge-Weber syndrome, Klippel-Trenaunay syndrome, Parkes-Weber syndrome.
Well, but sometimes they can be related to a venous malformation or an AVM.
There are multiple other indications. Mm-hmm. So basically, it's a matter of good clinical knowledge, skill. Gray hair helps, having seen a lot of these. It helps you discern which these particular pathologies possibly could require imaging studies. So they certainly can be indicators of underlying other problems.
Hi, Missy, Stephanie, Yanari. Hi, Kiana from Trinidad. Mahalia, Balan, hello. Yolanda has a question. She's from Canada, and all the doctors have recommended they wait for laser. Why would they recommend we wait? I think my daughter is 9 months old and is on 70% of her left side of her body, including face, neck, and scalp. MRI has ruled out Sturge-Weber.
Well, I was born and raised in Vancouver, Yolanda, and unfortunately I've heard from my Canadian patients that they seem to wait in Canada. I'm not sure whether this is a decision to postpone the treatment or they just don't have the resources within the Canadian National Health System to start this. But I would encourage you to have your daughter treated as soon as possible, particularly that face and neck component. I would leave the scalp alone, as we've discussed earlier. The neck should respond very, very well, but I would recommend that you start the treatment on her face as soon as possible.
And Yolanda, if you can't find anyone in Canada, please message me at birthmark.org/Dr. Linda. And we have some options for you in New York. I mean, you have to cross the border, but you can get early, aggressive, and excellent treatment. And you can also come to California. Hi, Erin. Welcome. And Melissa says she's trying to get an MRI in Alberta, Canada. And it's hard when the entire body is involved. Wait time is very long. Also getting genetic testing done for the enlarged side of my body.
Well, you're getting the appropriate workup. I mean, I know some of the people at Calgary Children's Hospital. So, I mean, you're just going to have, I mean, it's a problem with the Canadian National Health System. So just push and make sure you get those imaging studies done as well as the genetic testing, as we've discussed earlier.
Kimberly says, what's the most difficult area to treat? Her son has a V2. And they've had 17 treatments. First was at 5 days old, which is great.
Mm-hmm.
We haven't had great results. Should we give up? I
would not say, again, we need to review the treatment parameters of your son's port wine stain, what specifically pulse durations of the laser were used.
Mm-hmm.
The V2 dermatome is certainly the most difficult area, particularly the medial cheek as well as the upper lip. Those are areas that classically sometimes do require many more treatments as compared to the lateral face. But at the age of, how old is yours? Just says your son is 2. I don't know.
17. I don't know. But,
how old he is.
And also, Kimberly, who and where are you having the treatment done? Let us know that, because, very passive settings can mean no results, where you have to go to experts who know the exact settings. Vincent, hi Vincent, he has had over 6 PDL by a doctor in Philly with lightning, but a good amount of hypopigmentation, scabbing, hyperpigmentation, scabbing, and weeks to heal. He's recently been treated by Dr. Levitin with much better lightning, no hyperpigmentation in time. What are the parameters that affect treatment outcomes?
Well, it's the energy of the laser used, it's the pulse duration of the laser exposure, it's technique, how the procedure is performed, and making sure that you don't overlap, you don't double pulse on individual spots. The hyperpigmentation I wouldn't worry about. I'm assuming you're adult. If you're in Philadelphia, I can certainly highly recommend Dr. Eric Bernstein, who I know very, very well. I've known him for 20, 25 years. He'll be the president of the American Society of Laser Medicine and Surgery next year. You might want to seek a consultation with Eric in Philly. He's a highly experienced laser physician.
And that's the problem we have a lot. Experts can be within a city and people do not know how to find them. Hi, Stephanie. Welcome from North Dakota. And Melissa, for the MRI imaging to be done, what specialist is best to order it?
It can be ordered by anybody.
Right, dermatologist.
It can certainly be ordered by your pediatrician. A lot of times we will, if somebody comes to here, I actually try to get the imaging studies done here at UCI, because we have one of the world's leading authorities in vascular diagnostic. So I try and get it done, but I mean, it can be ordered really by anybody.
So she's an adult and probably not her primary care. I would have her go to a dermatologist maybe.
Just somebody who makes sure that the proper
anomalies.
Imaging study is ordered. That's the most important thing. I mean, an MRI itself isn't going to be helpful. Make sure they're doing the study and they're combining it with an MRA, because you want the gadolinium contrast to be injected so that you can see what the distribution is of the blood flow in the area that's being imaged.
Okay, so we can take some more questions. I think we've caught them all. If Kiana, I know you said something about your ear, but I think you might have been addressing the question someone had about the port wine stain in the ear. And I'm not quite sure what it was, but I noticed you posted again and said the word ear, so I thought you meant there might have been port wine in the ear, and it can happen. And okay, Christine Ann Blackburn. Okay, she just said thank you. Wonderful, and thank you.
To follow up to your question, Melissa, and get it done correctly, I didn't see that part of the question. It was hidden. So, it definitely needs to be, interpreted by somebody who's highly experienced in reviewing these types of imaging studies.
So I know some of you are typing, so get your questions into us as soon as possible so we can see them. Oh,
You just clicked out of it.
no, I didn't.
You're on the BBF work page.
Okay, sorry about that. We just had a little snag.
You wanted to see your own website.
Right. Linda, would laser treatments help Jessica scar lighten up? So,
well, there are a number of lasers. I don't know what type of scar your daughter has, Stephanie, but certainly we treat scars here for post-traumatic scars, post-surgical scars, post-operative scars, hypertrophic burn scars. I mean, in addition to treating with the pulse dye laser for the redness, a number of the fractional laser skin resurfacing procedures can be very, very helpful to treat scars. And in fact, I'm going to spend all day Wednesday and Friday this week doing that.
Infinity said her daughter has had 11 treatments and she has a port wine on the right side of her face, ear, neck. She's lightened up, but the ear is very stubborn, goes in. She started at 26 weeks old and is now 4 years old, 26 months. She's had an MRI at 40 days, does need another one for treatments. Our doctors say maybe 20. And does she always need to stay away from the sun her whole life?
Well, people want the skin to be as white as possible when somebody's undergoing laser treatment. The lighter the skin, the more effective the laser treatment, because epidermal melanin sits in a layer above the surface of above the port wine stain. And if the patient's tanned, it definitely makes the laser treatment much less effective. So I would encourage you to use hats, sunscreens. The dermatologists like the Elta MD UV clear sunscreen, which is very hypoallergenic. Both my wife and I are very allergic to all sunscreens, and both of us have found that to be a winner. You can buy that on the internet, and I would encourage you to use that as well as hats as well.
Kimberly said her son's first treatment was 5 days old.
That one we already answered.
Okay. Donna said, what are the benefits of the new Prima laser?
Well, the advantages for us are it has a much larger spot size and a faster repetition rate, which means we can do the procedures much quicker. So this becomes critical when you're treating infants and young children in an OR setting and you want to minimize the amount of time that they're being exposed to the anesthetic agent. So this will definitely help a lot.
The next question is, what are your thoughts on the effectiveness of rapamycin?
Well, it's controversial. I mean, that was actually developed in my laboratory. I mean, we're not using it routinely, and we just haven't found it to be particularly helpful. There are some patients who have benefited. I've been told by some of my colleagues who are using it. I mean, there's some other anti-angiogenic agents that are coming into the pipeline that I'm cautiously optimistic that will be better. And I'm hoping that we'll be able to start a clinical trial at Beckman next year with one of those.
Great. Rochelle wants to know if the skin is still patchy in color after deciding to finish treatment after perhaps 17. Would you expect the patchiness appearance to even out at all?
Yeah, as I said earlier, there was a question on this. Is that patchiness appearance just as a matter of filling in the areas between the individual laser pulses, which can be done by somebody experienced doing this treatment. So I would expect it to even out completely.
Kimberly, I thought we answered yours, but if not, please retype it. I apologize. We've been like on top of these. So Kimberly Lammers, go ahead and resubmit your question. Krasmir said, hello, I've had 8 V-beam treatments and I think I'm at a point where I see no progress. My dermatologist thinks I should stop. Should I?
No, I would definitely have your medical records reviewed to see what treatment parameters, particularly the energy, the dosimetry used, as well as the pulse duration of the laser exposure.
And remember, Krasimir, you can always write to Dr. Nelson, find out what your settings are and send them to him and he'll give you his opinion. Hello, Sebastian. You've been hearing different opinions from Baskin regarding the medical necessity to use PDL on infantile hemangioma. Is this based on the fact that now we can use propranolol, and this may change depending on the type, size, and location?
Well, we're using, for the treatment of hemangiomas, we're using the combined approach, be it either topical timolol for flat superficial lesions or oral propranolol for deeper or more complicated lesions. It's been demonstrated in the medical literature that if you combine the two treatments, and by that I mean the beta blocker and the laser, you can decrease the amount of time that the child has to be on the beta blocker by about 50%. So I think most of the medical experts now would pretty much agree that it's a good idea to use these two treatments synergistically, which is what we do and what we're doing with your child.
So Christina wants to know, this may have been asked already, for smaller port wines localized
We
over
answered
the
that.
left narrow. Okay, okay.
Yeah, that's what
How do you know when to cease treatments? My daughter has had 17 in the past 3 years.
Well, when you haven't seen significant, fading that you and your family can discern after about 3 laser treatments, then I would consider going to a maintenance program, but I would certainly not stop the treatment completely. Otherwise, you're going to have issues with hypertrophy and nodularity later on.
Holly said her daughter had about a dozen treatments with you 5 years ago. The remainder of her has stayed the same. Does she still need to get regular maintenance treatments, or should she wait until she sees changes?
Well, ideally, you would consider a maintenance procedure once or twice a year, but fortunately, it seems that the treatment that we did years ago was successful. So, would you be kind enough to bring them back in, and we'll have a look, and we can sit together and decide what makes the most sense in terms of how to proceed.
Diana wanted to know about the lip, why it doesn't get dark purpura as the rest of the face.
Well, the purpura has to do with what pulse duration of the laser exposure was used, and sometimes, particularly on the upper lip, where the blood flow is particularly high, you have to use higher energies of the laser. So some of the purpura that you may see immediately after the treatment may actually be pushed out by the high blood flow. And so at the next laser procedure, we're probably going to have to, or your physician is probably going to have to increase the energy of the laser.
Emma wants to know, will the laser help with the thickening in the lip, or does it just help with the color?
The laser is not going to be as helpful for the lip thickening. If you can do it in infants and young children before they develop the hypertrophy, I think you have a chance to control it. But once you've developed significant hypertrophy, that child then becomes a candidate for surgical lip reduction.
And Christy said about the same thing. She said that her son has like a fatty cheek where the port wine stain is. Oh, Kimberly, I'm sorry, yours just said 5 days old, V2. Is this the hardest area to treat?
Yes, we just discussed that.
Okay.
The V2 central
17.
face and upper lip is by far the hardest area to treat.
What is the shortest frequency recommended between intervals? Like what time period?
Well, for infants and young children, our standard of care here at Beckman is to now do those every 4 weeks. For the hemangiomas, we're treating those children even more aggressively to try and get them off that propranolol or beta blocker as soon as possible, and we're repeating the treatment every 2 weeks.
Oh, Christina, she said she's a physician and that she was talking about her daughters before and that it does blanch very much. So it could be a hemangioma. And on the VBF website at birthmark.org, there is a Dr. Sophie, I can't remember her last name, but she is in Nashville. So go to birthmark.org, click on Find a Doctor, and then go to Tennessee, and you'll see Dr. Sophie something from Nashville, Tennessee. And she's an expert, and she does laser and drug management.
We've already answered Yolanda's.
Yolanda's has been answered. Stephanie, we missed your question. Resubmit it. I thought we answered it. Erin said, thank you for being out there. Our 15-month-old just had her 15th treatment. What a journey. Thankful for this group. You're very welcome. Okay, NH Perry said she found it. Okay, Erin said port wine stain on upper lip, nose, and a little between the eyes. Okay, maybe you're responding back. So,
I mean, those port wine stains that typically on the upper lip, nose, if it's an infant, young child, those port wine stains actually tend to respond very, very well. So I don't know the context of your question, Erin, but I would encourage you to have your child treated because those types of vascular birthmarks do respond very, very well.
Kendra says her 11-month-old, her son is 11, and her doctor won't start treatment until he's 1, and to have to put him under because that's his comfort level. It's pretty light compared to the others. Kendra, you can message me at birthmark.org /Dr. Linda so I can see if there's any other options, any other treatment specialists. You can just get a free opinion with Dr. Nelson and with Dr. Geronimus, and one's on the West Coast and one's on the East Coast.
If you let us know where you live, Kendra, we'll try and refer you to somebody who will speed up that treatment interval.
And Melissa, I'm sorry, our thing keeps going down. For the MR imaging, she said, what specialist? It's again, in Canada, I'm just not sure if your family doctor won't do it.
Well, your family doctor can order it, but her question is who's reading it. So, I
Right.
mean, this needs to be done, interpreted by a radiologist, a diagnostic radiologist who's highly experienced in interpreting magnetic resonance angiograms.
And we have one in California who offers to do it, Dr. Hassel. We
Yeah.
have one in New
Our
York.
institution, yeah.
So you can email Dr. Nelson or myself once you get it, Melissa, and we can have one of them read it for you. Christina said she's an anesthesia. Thank you for the webinar, imaging on small. Okay, so this is a different doctor. Thank you for, the webinar that we did, yeah, on small port wine and V2, yeah. I mentioned that, the one in Nashville.
I can also
I
recommend,
also-
Christina, there's Dr. Brian Biesman, who's actually he's a double boarded in ophthalmology and facial plastic surgery. Brian would be a good resource to ask about in Nashville.
And you can message Dr. Nelson and he can message you back that information. Heather, should we be having the laser done on the lip as well? Her daughter is 2 and has had 14 treatments. They've only done her lip once.
Sure, there's no reason not to do the laser treatment on the lip, Heather. So I would encourage your physician to continue to do that.
Natasha's daughter has KTS and CMT. She has had this severe 90% of her body, all her limbs. She's going to Great Ormond, which is obviously in England, and to get a skin biopsy. Then that you're worried. Okay, do you think it's more risky? I mean, you had the biopsy isn't.
The biopsy is a trivial procedure.
That's minor.
They're gonna probably put a little bit of topical anesthetic on the skin, or just a little bit of local. The biopsy will be only 3 to 4 millimeters, and you can either put one little suture in there, or you could actually now there's a gel that you can actually put that will plug up the biopsy site. But I wouldn't be concerned that your daughter's going to have a higher risk of bleeding or hemorrhage from a simple biopsy.
And Natasha, can you message me on here or through birthmark.org/Dr. Linda? I'd like to see a picture, especially of her back. You're saying it's a huge malformation. I don't know if you mean a huge port wine or an enlarged malformation, and with the staining and possibility of cutis marmorata or Klippel Trenaunay. I'd like to see her pictures and see if there's a really good multidisciplinary expert in Europe that I could have take a look at that for you. So just message me her pictures. Jessica says she's leaving the area with the hair affected by the port wine untouched. Will the hair have different texture or color?
No, the hair will be totally unaffected. The hair follicles are much deeper in the skin. They're actually underneath the port wine stain. So no, it will not change it at all.
So we have 18 minutes left, which is still a pretty good amount of time to answer questions, and we've had 119 so far, so that's pretty good. And this video will be available as soon as we're done. You can rewatch it, re-listen it, listen to it, and you can also message Dr. Nelson at birthmark.org/Nelson or myself at birthmark.org/Dr. Linda. So, and then you can also reach us through our website at birthmark.org. And you can look right here in the string where all the comments are, and you can see our website and how you can get a hold of us. So we have almost 15 minutes left, a little over 15 minutes. If you didn't see any of the other answers that came through, you can watch this again tomorrow. If you have some new questions, especially about parameters or settings, you can send your child's picture with those settings to Dr. Nelson for his opinion. And remember, next October we'll be in New York City. Katie says, Katie Foley Nelson, she has 2 daughters in the VBM world, one with a hemangioma on her lip, who has had great results with probably the propranolol, and the other with the LVM, lymphatic vascular malformation. We're happy with our care. She had Children's in San Diego. Just want to say thank you for all you do. And you're welcome. Okay, so Kimberly's saying 595, spot size 1.5 millisec.
No, that's the pulse duration.
I mean, the duration.
The spot size is
Right.
the 7 millimeter.
Right, 7 millimeter spot size. So what do you think about that? I mean,
Well, we don't know what the energy density is, and I would use larger spot sizes. You always want to use larger spot sizes,
Well, they're-
14 joules. That's a pretty high energy focus on a very, very small spot, Kim. I tend to use 8 to 10 joules per centimeter squared on a 10 to 12 millimeter spot. It's safer to use the larger spot sizes with the newer devices and distribute the energy over a larger area as opposed to focusing the beam down on a small spot.
okay, we already spoke to Christina. You spoke
answered
to
that
her.
one.
Diku, hello, Dr. Linda. I sent you photos for Visible on mail. Also has questions in my country. Education about is in a low level. Clinics have not laser. I'm not sure where you live. Can you remind me of where you live? I think, are you the one that's from Malaysia? And okay, dark. We push hard on the skin. It becomes light. Baby is 4 months old now. Oh, and so it is brighter. You know, you might want to send me the picture from birth and now to see if it's a hemangioma. If it's darkening, right, Dr. Nelson? It may be a hemangioma. And if you did send me the pictures, I'm thinking I responded. Maybe gave you someone that you could see. Heather, should we be lasering the lip?
We
Daughter
answered that.
is 2. Okay. And then, okay, so Melissa's going to see a dermatologist this month, and she'll give them the information. So that's good. Yeah, Diku, I'm not quite sure what. You'll have to remind me. I'd have to go back through my emails and know what your email is. So I get so many to know to see what the picture was and what your questions were. Many countries do not have good education about vascular anomalies, and that's why we created the I-Team. We've brought our experts to India, Russia, Israel, Italy. We're going back to Europe next year. And
Vietnam. We have a clinic in Vietnam
there's
now.
a clinic in Vietnam.
Rock Sanderson and I are going there in January.
Yep. So if there's anybody in Vietnam who can get to, where do you have those clinics?
Ho Chi Minh City or Saigon.
In Saigon.
We'll be there the 18th through the 24th of January.
Will you be doing any free laser? Will that be available?
Oh yeah, the whole time.
Because I have a patient, Moy Mint, who I'd like to refer to have.
Well, you need to
his
get
son.
them in touch with Dr. Min, who's the person organizing locally.
Okay.
So I'll have you
Yeah, get that information from
get
me.
that
from all.
no problem.
Aaron Cox wants to know, how do you determine when you are ready for maintenance? Our 15-month-old is at 15 for port wine stain, and mainly on upper lip, nose, and a little on
We've
forehead.
had this one we answered before.
Oh, we answered that.
Pede derm estimates.
4 to 6 more. Okay. I can't remember that we already answered those. I don't know if they're cycling through or if they're just asking them again. Or sometimes they get pinned. You know, we pin them where you can see the word pin, and so then they.
What does that mean? I don't even know.
It means it
I'm not a
stays. It
Facebooker.
stays there permanently, so people can like attach more comments to it. So we have 12 minutes left. Hi, Kiana. Not sure how old, but doctor put the grommet thing in my left ear with the port wine. I don't know what that means, a grommet thing. Do you know what that means?
No, we'll Google that word.
I know, Kiana, that was a long time ago, sister.
I mean, maybe the grommet is like an earplug so that the spray doesn't go into your ear or the laser beam doesn't go into the ear. I'm not sure what a grommet is. I'll have to Google that word later.
Well, I mean, I
Wikipedia.
know what a grommet is. It's like a fastener, like a metal fastener. They look like gauges that they put in people's ears. I'm just not sure what Kiana's talking about. Maybe because she had so much port wine stain and tissue hypertrophy, and she did have problems with her ear that maybe they did something. I'm not sure. Not quite sure. But okay, well, we have 11 minutes left. So
Well, there's one there from Brianne Riley, who I actually know. She's
noticed the pores on her facial have changed recently. Looks like a bunch of little holes only on the port wine. Is this common, and any advice?
Well, you may be
that?
developing some insidious hypertrophy of your port wine stain, Brianne. So would you be kind enough next time you and John are available, bring the girls down, and I'd like to see you back here at the Beckman Laser Institute.
Okay, where did that go? Oh,
Tiana?
Okay, but the doctor, okay. Jennifer says her daughter is 11 and has had 9 treatments. Her doctor increases the energy a half joule. We're up to 11 joules with 1.5 duration, 7 millimeter spot size.
Well, I would encourage you to use larger spot sizes. Your physician to use larger spot sizes. As I answered earlier, I don't like to focus the laser beam down on small spots.
Okay.
That can lead to problems. So I would change that.
So Kiana let us know that the lights do keep going out. She's like, it's like you're watching Revolution every time the lights go out. It's so funny. Okay. Our thoughts, effectiveness of rapamycin. Our doctor will use it on our son only after we notice no further. We discussed this earlier,
and right now there's no good literature on a large volume of patients that's been demonstrated that the use of rapamycin in combination with a pulse dye laser is going to enhance port wine stain therapeutic outcome. As I've said, there's a number of newer anti-angiogenic agents which are coming onto the market, and we're going to be looking to begin a study with one of them early next year.
Mary Kathleen said her son is 16 months old. He has a V2 port wine. They started at 5 months old, and he's had 13 treatments. We are due to go back for one more treatment and then hopefully head into maintenance. How do we know how often to treat while in maintenance? How do we know when it's
usually in maintenance? We will treat every 6 to 12 months, so at least once or twice a year I would recommend. But 16 months is a little bit early to go to a maintenance type of treatment. I mean, usually those children we can continue to get fading. So I would encourage you and your physician to review the treatment parameters that were used to see if there's an opportunity to change the pulse duration of the laser, and hopefully you'll be able to get some more clearance than you observed, at least at this point.
Pardo asked a good question. What is the value of genetic testing, even if there's no drugs? Well, we know that Dr. Comey's study came out and found a gene for the port wine. That was very significant, first of all, because so many people wondered what they did wrong that caused it. Now we know it's a mutated gene, and that does eventually lead to clinical trials, which can lead to treatment protocols. So it's, you know, it substantiates that paper that Dr. Comey published. I mean,
plus, in addition to that, the RASA1 mutation's been associated with arteriovenous malformations. So those vascular lesions that one might think is a port wine stain, which are primarily on the venous side of the circulatory system, knowing that somebody was RASA1 positive would certainly change your clinical management of how that patient would be approached.
So this is question 1, is MRI required? Her daughter is 4 years old with a V2, but it does go back on her scalp. And there is a tiny spot in the corner of her eyelid. We never had one done because we saw a neurologist and we took a wait and see approach. She's not.
Well, what I would say is that if your child is developing, the chances of having Sturge-Weber syndrome are low. They're certainly not 0. But what I would say is that should your child have a febrile seizure or have some traumatic injury in which somebody's considering doing an MRI or a CAT scan, I would ask them to look for Sturge-Weber syndrome. But considering the fact that your child is doing very well, she's meeting all of her well baby checks, she's not having any problems with seizures or any objective neurological deficits, I would agree not to repeat the MRI study.
Vince wants to know, are there any treatments on the horizon that can possibly halt the progression of the port wine completely? Do multiple PDLs make it more difficult for a port wine stain to regenerate?
Well, they do, because we know you're disrupting those angiogenic pathways. And so that's why in infants and young children, we're treating those patients so aggressively in an attempt to be done by one, as Dr. Geronimus would say.
Giles said that her daughter is 7 and has had 25 treatments, but none in the past year, and that there was no more response or clearance. But the clearance is okay. It's still darkest on her cheek area. We were not planning on maintenance unless she wanted to. Would you advise this is okay?
Well, 7-year-old, certainly your daughter's going to go into puberty in the next couple of years, at which point I would expect your daughter's port wine stain to insidiously and slowly get progressively darker as she goes through those hormonal changes. So I would encourage your daughter to have some kind of a maintenance treatment, because certainly within the next couple of years, her vascular malformation is going to change.
Well, Kimberly wants to know about the lasers, the settings on the laser now, but that's kind of an all-over question, right? That depends on stain and location, right? And depth and thickness. And She's just saying, wondering about the settings of the laser now.
Without knowing what the settings are, I
Right,
can't comment.
right. The FDA has approved only a few IPL lasers for treatment of port wine. What is the difference between PDL and IPL? Individuals has asked if there isn't access to a physician with a PDL, would an FDA-approved IPL be the next best option for treatment?
Well, an IPL is not a laser. A lot of people are confused. An IPL is what's called intense pulse light. It's basically like a giant light bulb, and it's much less efficient as opposed to the laser, because the laser is one wavelength. It's yellow light. I mean, you have yellow light in an IPL, but it's distributed within all of those other different wavelengths. So the IPL certainly can be used to treat vascular malformations and port wine stains, but it's a far less efficient means of actually doing so. Hi, Jacqueline. I didn't realize that was you.
Mm-hmm. So Patricia Huntsman Shepherd is 40, and she said she just started to treat her facial malformation, and then on Monday she'll undergo sclerotherapy on some of the large nodules. Is this a common procedure? I'd like to just say, message me, because I'd like to know who's doing the sclerotherapy, because it is tricky to sclerose in the face area. So I'd really like to know who's doing that, Patricia.
We'd also like to know the diagnosis. I mean, if this is
Right.
a port wine stain, nobody would really do sclerotherapy for nodules.
Right.
But if it is a venous malformation, assuming that this is done by an experienced interventional radiology, sclerotherapy would certainly be the most common procedure, and certainly the procedure of choice.
So Chris Wagner, Dr. Nelson did answer a question about the Prima. He is going to have it after the beginning of the year. And if you re-listen, I think he said that he wants to know how it's going to differ
We
from
talked
the
yet.
Perfector.
It's got a larger spot size. It has a faster repetition rate. So it will allow us to do these procedures much, much quicker, particularly on infants and young children under anesthesia.
Infinity wants you to share the name of the sunblock you mentioned.
It's called ELTA, ELTA-MD, MD, just like that. And it's UV, the initials UV clear. And you can buy that on the internet.
Natasha said her daughter, who is 8, is severely affected and has some very large hemangiomas that run deep. We're going to Great Ormond. I think we talked about her.
We talked about that.
Yeah,
we've answered
Jean. Okay.
Okay.
To have a biopsy. You mentioned that.
Yeah, we've already answered that
Yeah.
question.
So we only have 3 minutes left. So, let's get those last couple questions in, because we do have to sign off right at 6 p.m. And again, this entire Facebook Live session is being recorded. You can go back and listen to the answers. You can share it with people. Thank you for all of those of you who are in Europe that have stayed up all night or woken yourselves up. This was at 2 or 3 in the morning there, right?
Britain, it'll be 8 to 9 hours to continental.
Yeah.
Britain, 8 hours, continental Europe, 9.
So we really appreciate that you've adjusted your sleep schedule to get your questions asked. And the video will be shared on all of the birthmark groups. Sometime over the next 2 days, I'll be sharing them on all of the port wine, hemangioma, and laser groups. I think, Natasha, we did already answer your questions.
Yeah.
Betsy, I'm not sure, it says you just joined. If you haven't asked your question yet, please do so, because we only have 2 minutes left. So once again, the VBF annual conference will be next October in New York. And the next Facebook Live session will be with Dr. Wayner, and it may actually be in Italy, December 8th, 9th, or 10th. There'll be an announcement about that coming up in the next few days, so it'll give all of our families in the European time zone a chance to chime in, and all of our families from back here will have to wake up and sign up for it. Alrighty, so we have 1 minute left. Gabrielle, hello,
Hi,
Gabby. Hi, Gabby.
How's Alonzo?
So we have
How's Enrique?
we have like just 1 minute left, and take one more question. 2 of them pop up, we'll do it, but we do need to sign off at 6 p.m. So if we don't get a question in the next, okay, we've had significant lightning. Hi, Lauren. Lauren V just joined. Jana, I'm trying to see the rest of your questions, so if you can hit it a couple times to make it go up. We've had significant lightning in all,
We can't read it.
I can't see it.
Oh, there we go.
Oh, there we go. In all areas but the chin, and even darkening, thickening near the lip. What laser parameters are most effective? Any other treatments? We've done 9 and been on Replimune for 2 years.
Well, we typically in those areas, we'll probably be using energy densities on the order of 8 to 8.5 joules per centimeter squared, pulse durations of 1.5 milliseconds, delivered on probably a 10 millimeter spot size. I mean, that's sort of a routine approach that I would use for infants and young children. We discussed about Rapamune, which is the other name for rapamycin or sirolimus. We just haven't found, in our experience, that to be particularly helpful.
So Aaron, I'm not sure if you asked a question before, but you said, when do you move to maintenance for your daughter? Do you?
When we haven't seen significant fading after 3 or 4
Okay.
laser treatments, then I would consider a maintenance approach every 6 to 12 months.
And Betsy, I think we already addressed that, right?
It's a venous malformation. I don't recall answering a venous malformation.
Yeah, that was the one that we just talked about, the vascular malformation. She's answering that it's venous.
Okay, so
if
it's a venous malformation, then the sclerotherapy is entirely appropriate.
But I'd still like to know who's doing it in the
should
face
be done
area,
by somebody
because,
highly experienced,
right,
because that's a tricky area. The lights went out at university.
Okay.
Again.
So it's 6 o'clock, the lights went out, and that's our time to sign off. So thank you all for submitting your questions.
Happy Thanksgiving, happy holidays.
Thanksgiving, and a happy belated Veterans Day to all of our veterans. And we look forward to seeing you all on our next Facebook Live. And a big thank you to Dr. Nelson for taking this time to answer these questions. And a big thank you to the Beckman Laser Institute for all the support they give to Vascular Birthmark Foundation and all the families affected by vascular birthmarks. Thank you all.